taking out time to do this interview. Would you please provide some information about your background?
Yes, so thanks for having me. So my name is Daniel Hryhorczuk, as Luke said. I am a physician. I'm a professor emeritus at the University of Illinois School of Public Health in epidemiology and environmental and occupational health sciences. And I served on the board of scientific counselors for the Centers for Disease Control for their National Center for Environmental Health.
Thank you. So doctor, in school, we have been discussing the COVID-19 virus in several of our classes. I would like to ask you a few questions regarding some ethical issues posed by COVID-19.
Yes.
Okay. Do you have a set of ethical principles that you use when faced with difficult questions or situations?
Yes, we do. In medicine, there's a tradition called bioethics that actually started with Hippocrates when he said, one of the first things you want to do is do no harm. And we as physicians, we recite the Hippocratic Oath when we get our diplomas. But there have been much more recent advances in the field of medical bioethics within the last about 15, 20 years. And medical bioethics has come up with a list of guiding principles for the physician-patient interaction. And we use those principles to guide us. And in addition to that, public health authorities have supplemented those with a few additional public health principles. So that's what I use generally as my guide in making some of these difficult decisions.
Mm-hmm. What was the greatest obstacle that you faced in applying these ethical principles?
The greatest obstacle is applying the principle of proportionality. So in order for me to get to that, let me just highlight for you what some of these principles are and why this proportionality is the most difficult one to apply. One of the first principles that we apply in our physician-patient interaction is a principle of beneficence, which is basically that we as healthcare providers, our goal is to benefit the patient, to help them in some way. I mean, it's self-evident, but it's important to acknowledge that our role is to actually help patients. The other principle in interacting with individual patients is called non-maleficence, which is basically do no harm. So as Hippocrates says, do no harm. We as physicians should not intentionally do anything that would harm the patient. So these seem obvious: help the patient, don't harm the patient. In addition, the other two primary principles, one is a principle of autonomy, which means that we have to respect the individual and their right to make their own decisions. I can't be just paternalistic and tell somebody, I'm going to treat you this way and that way because that's the best way to do it. I have to understand that they're an individual, that they have the right and the ability to make their own decisions, and I have to respect that. So the patient has to be a part of the interaction, and I give them the autonomy to make these important decisions. And another important decision is a principle of justice, that there's a fair distribution of healthcare among all the members of society, especially those that are in some way disadvantaged. So this idea of justice is very important. So these are the main principles of what I would call medical ethics for the interaction between patients and their healthcare providers. But that wasn't enough to apply to society as a whole, because clinical medicine means we're taking care of individual patients. Public health means we're taking care of the population as a whole. So we had to supplement these principles with a few additional ones. One of them is a principle of health maximization, which means that our goal as public health professionals is to maximize the health of the population as a whole, not of a few privileged individuals, but of the population as a whole. Another one is a principle of efficiency, which means that healthcare resources are always scarce. And if we could give healthcare to everyone, that would be great. But It's very difficult to do that, so we have to be efficient in the way we do it. There's a limited number, or was a limited number, of respirators to treat COVID patients. We have to make sure that they're used efficiently. There was a shortage of masks. We have to make sure that they're used efficiently. And that then comes down to the last principle, which is the most difficult to apply, which is the principle of proportionality. And what that means is that we have to weigh the individual freedoms against the benefit of society. We give the patient autonomy, the individual autonomy, and yet there's a tension there between what they feel is good for them, what their rights are, and the benefits of society as a whole. And the best example of that right now is the controversy over wearing masks. People say, I'm not going to wear a mask, it's my right not to wear a mask. At the same time, we as public health professionals have to think, what is the benefit to society as a whole, to the population as a whole? And that's where the greatest, in answer to your question, that's where the greatest tension comes in. Because these principles, they're guiding principles. They're not things that are absolute. I absolutely have to do this. In any given situation, you have to weigh the various principles, and you have to make a difficult ethical decision as to what to do.
Now, just to go into further detail, for your principle of what was that? Justice, or what's something with the J?
Justice, right? Mm-hmm.
Justice. If you had one patient who was severely injured and needed more treatment rather than another patient, would you fairly distribute, or would you provide more treatment to the client?
Right. So in medicine, it's a concept called a triage, which means when the best way to think about it is an emergency room setting. Well, all of a sudden 10 patients come in. One of them's in cardiac arrest, another has a tick bite, and someone else has a fever. You're going to treat the one that's in most need first. So we triage to try and balance the amount of care we can give to those that need it the most.
Okay, well, thank you so much for answering that.